Hello, everyone, and welcome. We are going to get started in just a few minutes. We're going to give people a chance to log on and get their audio situated. Hello, everyone, and welcome. We are going to get started in just about 15 seconds here, but as you are logging on, please take the opportunity to introduce yourself in the chat so that we can get to know our audience today. Okay, we are going to go ahead and get started. Good afternoon and welcome to the Indiana Youth Institute's webinar, Implementing Evidence-Based Interventions for Youth Mental Health in Community Settings. My name is Joshua Long. I'm the Senior Educational Content Manager here at IYI. Thank you so much for joining us today. We are grateful to have the chance to connect as a community of Indiana youth workers who remain committed to meeting the needs of our children and youth. For those who are not familiar with IYI, our mission is to improve the lives of all Indiana children by strengthening and connecting the people, organizations, and communities that are focused on kids and youth. Listed here, you can see our vision that drives the work we do for Indiana youth. And before we begin, I'm going to share a few pointers that will help you engage with today's webinar. For any technical support issues, use the chat feature to send a message and I will assist you the best that I can. You can use this feature to converse with the group as well. And I can see lots of introductions in the chat. Thank you. We also encourage you to ask questions, so please use the Q&A feature for any you may have, and we will get to as many as possible. You can also upvote any questions that you see and want answered, and the top ones will move to the top. Later today, you will receive an email with a link to complete an evaluation of this webinar, as well as the presentation slides. Please take a few minutes to let us know your thoughts about today's presentation. If you don't receive the evaluation email, check your junk as it may have been directed there. And then once you complete the evaluation, you will be redirected to your certificate of participation. Like all of today's webinars, today's will be posted on our website if you'd like to revisit a portion later or share the opportunity to listen in with partners. And with that, it is now my pleasure to turn it over to our speaker today, Dr. Bridget R. Marriott.
Can you see my screen okay?
Not yet.
Okay. See.
Okay, yeah, I see it now.
Okay. All right. Well, good afternoon, everyone. I appreciate you all putting in the chat where you're from, and kind of your roles. I think that's helpful to see the kind of broad array of youth serving settings that you all work in. And I hope that I've made this broad enough that you can kind of see how it could fit within your particular setting. So my name is Bridget Marriott. I'm an assistant professor in the Department of Psychiatry at IU School of Medicine. And I'm also a licensed clinical psychologist, where I work at Riley Children's Health in downtown Indianapolis. So just a kind of brief outline of what today is going to look like. So really just starting with talking about like defining and describing what are like evidence-based interventions or evidence-based practices. What is the availability of those? How does the access to EVPs look like in community settings, as well as what are some of those common barriers and facilitators to implementing EVPs in community settings? And finally, ending with strategies for supporting the implementation of EVPs. So I want to just start by talking a little bit about the need for effective behavioral health services for youth and families. So approximately 1 in 5 youth experience a mental health disorder each year in the US, and youth mental health problems have really worsened since the COVID-19 pandemic. And this actually led to the declaration of a national emergency in youth mental health. There's a critical need to ensure that we have high quality, effective behavioral health services and that those are available to improve and address behavioral health difficulties and prevent long-term problems for youth. So it's really important to know like what are evidence-based or effective interventions and treatments and a little bit of the history behind those treatments. So that I don't know if you're all familiar with like the evidence-based movement and evidence-based medicine movement, but it began around in medicine around the 1990s. At the time, medicine was viewed as more of an art than science and really relied a lot on on tradition, and sometimes was relying on out-of-date information because of that. So there was a really big push to incorporate current scientific research evidence into clinical decision making, and this movement moved to other fields and professions like behavioral health. So in particular, thinking about psychotherapy or psychosocial interventions, we started to develop criteria for establishing the effectiveness of psychotherapy. So there was a 1995 task force that created criteria for establishing whether a psychotherapy is effective for a particular problem. And this was really developed to help keep psychological treatment prominent and so that those psychotherapies with the most research support could be identified and prioritized for training and dissemination efforts, as well as at the time for like managed care was requiring proof of benefit. So wanted to ensure that we were demonstrating the benefit of psychotherapy so it could be covered as well as needing to compete with pharmaceutical companies and showing evidence and the effectiveness of psychotherapy. At the time, the criteria that they developed was divided into well-established treatments, probably efficacious treatments, and experimental treatments. A more kind of recent update of that, because every so many years they kind of update the criteria and what that looks like. So this is the criteria that's used for the evidence-based updates for Journal of Clinical Child and Adolescent Psychology. Then they kind of break it down into 5 levels. There's a lot written on this slide, so I'll just kind of highlight some of the things on it. But it starts with level 5 being treatments of questionable efficacy, which means those treatments don't really work or haven't been found to be effective. Level 4 is more experimental treatments, so they might be kind of unknown or untested, haven't quite gone through a lot of studies yet. Level 3 is possibly efficacious treatments, so they might work. Level 2 is probably efficacious treatments, so it works. And level 5 are those well-established treatments that have been shown to work well across many studies. So one of the big kind of criteria within this is having treatments being studied through randomized controlled trials or RCTs. And those are the kind of gold standard of study designs because they often have a control or a comparison group and random assignment of individuals to a treatment group or to the comparison group. So our randomized controlled trial really represents this design that provides the strongest evidence and gives us the greatest confidence that if we see a positive result, that can be attributed to that specific treatment that was being evaluated. And without a control group, we can't always say that those changes we see aren't just simply part of like a natural trend. Maybe people are just kind of naturally getting better, or some other kind of characteristic of the individuals who are involved in the study. Like maybe they all had an increase in social support, and that's really why there was some improvement. We also want to see replication. So in the first box there, those level 1 well-established treatments, they typically have those RCT studies, and they also have more than one RCT study where they've been shown to have significantly superior outcomes or the same outcomes as well as other well-established treatments. So this often has to be demonstrated in at least 2 different research settings and by 2 different investigative teams. So we want to make sure it's not just one team that's finding all the positive results, but it's been replicated by different groups. So, along with criteria looking at the research evidence for a treatment, evidence-based practices or EBPs also incorporate clinical expertise of the provider and patient values, so like patient strengths and their sociocultural context. So, a lot of times, evidence-based practices or EBPs begin with the specific youth and inquire, like, what's the available research evidence that's going to help obtain the best outcomes for this specific child. And so a lot of times, if you're looking at things like the criteria I showed you with the 5 different levels, you'll see more of this like scaling of like, where's the quality of the evidence? What's the like impact of this treatment? And you won't see as much of this like dichotomous or binary like evidence-based and not evidence-based. Because we know that we still have a long way to go. Not every treatment is effective for everyone, and we still don't have great treatments for some specific mental health disorders for youth. And so these are looked at over time and can change over time as more studies are done. I also wanted to highlight kind of a common misconception that can occur. One being if a treatment or program is labeled evidence-based, then it has sufficient research support and evidence. And unfortunately, this isn't always the case. The term evidence-based is commonly used as like a buzzword by developers to market their program, even if there might not be sufficient research evidence behind it to kind of justify them using that. So it's really important that you review the available evidence and research for a specific treatment or intervention. A lot of times, these treatments or programs might have a website or something where it's labeled or marketed as evidence-based. And so being able to look at those websites and they should have like some sort of research tab or like evidence type of tab um, available on their website and taking a look at those and those studies that are included in there or the specific like information that they have can be really helpful to kind of evaluate whether those studies would meet that criteria that I had talked about. So, like, how many people were included in those studies? Did they compare it against anything? Was it compared to just no treatment at all, or to another well-established treatment? And kind of where those were published or where those studies took place. So really important to look at the available evidence and then also to see if it's in some of the lists of evidence-based treatments or databases. And I'll talk more about what some of those look like. But that's another place to look to see, is this program listed in those databases? And if so, kind of what level of evidence did they rate it having? So in general, what do EBPs tend to look like or evidence-based practices? One is they often have a well-defined set of treatment strategies that can be replicated by different clinicians, providers, staff. A lot of times they'll have like a specific manual that someone can follow and go through. Another is they're often specific to a particular population. So, this treatment's for adults with major depressive disorder or for pediatric obsessive compulsive disorder. So, a lot of times when we should be careful about saying like this intervention is evidence-based, really we should specify that based on like the research and the data, we have evidence that this intervention works for like this specific mental health disorders in the specific populations. And these are like the specific outcomes it helps with. EBP should also be able to be tailored to meet individual needs. So culture, ethnicity, language, family situations. There should be some ability for that EBP to be adapted to fit individual needs. And also it should be judged by the outcomes they produce. So certain like standardized symptom tracking or functioning tracking that happens to kind of look at the outcomes of that specific treatment. Sometimes it might be maybe an increase in certain behaviors we want to see or a decrease in certain behaviors that we would like to see happening less often. And finally, it should be supported by data, not just theories. So show consistent benefit across multiple clinical trials. So kind of referring back to that criteria we had talked about a couple slides ago, but showing that it's significantly better than nothing or no treatment, and significantly better than alternative treatments. So here's some of the evidence-based lists, registries, clearinghouses that are available. This is not an exhaustive list by any means, but I think these are some of the bigger ones. So throughout numerous clinical trials, reviews, meta-analyses, and now even these lists, which each have their own kind of criteria they use. There's a lot of consistencies across it, but some differences. They all pretty consistently point to the same efficacious interventions. And so some criteria or lists of EBPs include for like youth, there's the American Psychological Association or APA's Division 53. For adults, there's Division 12 has a list. There's also the California Evidence-Based Clearinghouse for Child Welfare, the Blue Menu of Evidence-Based Psychosocial Interventions for Youth, Blueprints for Healthy Youth Development, and Office of Juvenile Justice and Delinquency Prevention Model Programs Guide. So these are all different places you can take a look at and kind of help with evaluating a program and where its evidence is. And these are also helpful because they have to do with a lot of different settings, which from everyone introducing themselves, I know that you all are working in different settings, and so these can also give insights into what settings have these been studied in, what settings do these programs work well in. Just like any website, and anything that needs to be updated over time, always important to look at these and see like when was the last time it was updated? Because if it's been many, many years, a lot could have changed in that time. And I think in general, what we see most changing is often that more treatments are being developed and being added, which is great. There's more options. But some of these they kind of update in certain increments and it might change. Some might be yearly, some might be every so many years. Also, a lot of these might be funded through different mechanisms that maintain these and allow these to be updated. And sometimes there's instability of funding for those. And so sometimes some of these lists, a lot of these have been around for a while, but like I had another list on here that no longer exists. And so I took that off, and that was a really short amount of time between when I had last had it on the slide and now. So just important to kind of take a look every so often too, because there are changes that happen, and sometimes, unfortunately, some of these lists aren't able to be maintained over time. And why use evidence-based practices or EBPs? Well, they've been shown to be effective for a range of behavioral health problems in youth. They've been shown to outperform usual care, or kind of the usual care that's provided in behavioral health settings. And they've been shown to be more cost effective than usual care as well. And all therapies are not effective for all behavioral health problems. There's no one treatment that is effective for every single mental health problem. And there's no treatment that exists that's effective for everyone. So we want to be using, based on what we know, what has the most support at that time, and what will likely lead to the most benefit and the best outcomes for a particular child. And while there are a number of evidence-based practices available for a range of behavioral health problems in youth and families, unfortunately, EBPs really remain underutilized in community behavioral health care, which really limits their availability, accessibility, and public health impact. So, for example, only around 25% of community providers deliver evidence-based treatment for substance use disorder or co-occurring psychiatric disorders. Another study found low rates of clients receiving evidence-based treatments in state behavioral health systems. So around like 1 to 3% of youth with serious emotional disturbance and 2 to 3% of adults with serious mental illness were receiving one of 6 evidence-based treatments. And finally, in a national survey of around 1,000 youth serving providers, providers endorsed using the full range of evidence-based treatment strategies for the most common youth mental health problems like anxiety, depression, and disruptive behavior. But the most essential components of those evidence-based treatments tended to be rated lowest. So they endorsed using those like less frequently than other strategies. So for those who are familiar with some of those treatments, that's things like activity scheduling for depression, exposures for anxiety, and behavioral parenting strategies for disruptive behavior. Those were rated lowest. And so this lack of availability of EBPs is not exclusive to behavioral health or psychotherapy, but across medicine. So there's an often cited statistic that it takes about 17 years for only 14% of research to make it into routine practice. And so this gap is often referred to as the research to practice gap. So how do we increase the availability of EBPs? Kind of starting with just let's take a closer look at the implementation process. So this is the EPIS framework, and it proposes that the implementation process has 4 phases. So the first phase is the exploration phase. That's when an organization is like evaluating like what needs they have and the potential fit of an EBP for their setting. Then there's a decision to adopt a specific EBP. And during the preparation phase, there's a lot of planning and outreach regarding the EBP, basically preparing to implement it within the setting. Then typically there's some training or coaching begins, and then there's the active implementation. So hopefully the EBP is initiated and being used within the setting. And then finally moving into the sustainment phase where we hope that then that EBP is integrated within the setting and can be sustained and used over time. I think a lot of times when we think about, great, we found a program, we want to implement it, or this intervention, and we immediately jump to, okay, let's do a training on it. But really important to take a step back first and talk through a little bit about training, but also we'll talk more about like why these other phases are really, really crucial and important to actual successful implementation. So I think training is everyone's go-to strategy, right? And I mean, training has been identified as a necessary strategy for the implementation of EBPs. We need training to learn about something if it's new. But we also know from reviews of the training of training studies that training, as usual, often just increases our declarative knowledge, so like our knowledge of facts, and it can alter attitudes, but it produces little actual behavior change. Um, I think a lot of us can think back on many trainings that we've attended and never use what we learned in that training, right? So maybe there's a training we had to attend and we're like, yeah, that sounds great, but then we never ended up using what was in there. And this may be because those trainings are often these, single shot workshops that use passive learning strategies like didactic lecture, like what I'm doing here with you all. So when someone's kind of just talking at you and lecturing and providing like information that way. And we know that trainings that use active, behaviorally oriented learning strategies, the things that have like ongoing consultation or like role plays, ongoing support and feedback, that those often demonstrate more robust changes in behavior. But unfortunately, these more like intensive and effective trainings are often hard to access for a lot of clinicians and staff. And this is largely due to things like cost. So workshops are often expensive and ongoing consultation as well. And so many agencies sometimes can't afford to pay for their clinicians to go to these trainings. So if a clinician does really want to go, sometimes they might pay for it with their own money. Another is time. So workshops, sometimes some of these workshops for these evidence-based practices can be several days. It can be hard for clinicians to take that time off or get permission to take that time off and go to a 3 or 5 day workshop. And finally, accessibility. So high quality trainings are not available everywhere. I think now we have a little bit more accessibility with all the virtual formats that we have available, but still a lot of times there's still some difficulties with accessing these trainings because not all of them have that opportunity.
Dr. Mary, I had a quick question, if you don't mind.
Mhm.
Um, I think what you mentioned as far as training feels completely true. I think for a lot of the folks in the room, a lot of people that work with kids, time is just really tough. Like the idea of taking 2 days away from your current job to do a training seems impossible at times. And so, can you talk a little bit more about the effective means of training that you touched on briefly? Like the active presentations, that kind of thing.
Yeah. So yeah, time, like I think time is everyone's like one of everyone's biggest barriers, right? Because we have so much we need to do and so much we need to accomplish. And unfortunately, training is often put on the back burner. It's kind of like the tyranny of the urgent, like whatever's coming up. So if there's like any sort of crisis or anything like that going on, that's obviously going to be at the forefront and be what we focus our time on. So yeah, those workshops can be really difficult to attend, and we'll talk more about different strategies and planning ahead, and if like within an agency or organization they're thinking about an EBP that maybe requires more time, how they can work or think through how they might be able to address that if multiple people need to attend it or are going to be out for long periods of time. And so the big thing with training, right, is like we often start with like we have to learn the facts first. We have to learn more about the EBP. So training is really important. I think with those effective strategies, what we're often looking for is a training where someone's not just sitting there, but a training where they're more engaged, where there is that like role play. So like where you're practicing, like demonstrating a new skill you're learning, or where the trainer is kind of modeling like what that looks like or has really active like videos or things. You could just really see that in action and start to get a feel for or an idea of like what that looks like. And then that ongoing support piece is, I think, what's most critical. And we found like things like having consultation or support following a training when you're trying to then use that specific intervention is really helpful for actually changing behaviors and being able to then also uh, as barriers will emerge or challenges or something doesn't quite go the way you thought it would, that's the kind of your sounding board where you get to talk through with an expert around, I tried this and this came up, or I'm not sure how to apply this to this specific child. That can really help somebody learn those skills and actually start using that EVP more. So hopefully that answered the question, but if not, feel free to put it back in the chat.
That definitely answered it. I think in a lot of ways it's just something that's always going to be there is the lack of time.
Yeah, definitely. So kind of going back to those phases of implementation, training is likely a necessary strategy, right? But probably not sufficient for successful implementation. And despite the exploration and preparation phases being really crucial to the implementation process, I think these phases are generally received less attention. So we need a multi-phase approach and to pay attention to other phases of the implementation process just as much as we do implementation, especially if we want to make these EBPs work in real world youth settings. So in addition to those phases of implementation, I want us to think about like what else can impact somebody being able to use an EBP or implement an EBP in their setting. So take a second and think about all of the different things that impact your work every day that you do. And For all of those things that do impact your work, are all of those in your control? Like, do you have control over them? Like documentation, certain policies? I'm guessing no. And so some of these are like organizational policies or requirements or things. Um, but also some of these might be above that, right? Like at the more system level, like documentation needed for insurance. And so there's a ton of barriers that can influence the availability and implementation of an EBP that can happen at many different levels. Um, so at the individual level, someone's like attitudes towards a specific evidence-based practice could impact their delivery of the EBP. Or at the organizational level, right, like certain, so like agency support or the kind of climate around implementing the EBP. At the system level, reimbursement rates, and then even the actual like intervention itself, right? Maybe there's barriers to engaging in that required EBP training that we talked about, like the amount of days they want you to attend a workshop is just not going to work with your setting. So all of these can potentially influence and impact successful implementation of an EBP. So just to kind of dive into those additional factors a little more and the things that should be taken into account when planning to implement an EBP. So starting with like the thing, like the intervention or the EBP, this it includes a lot of different characteristics of the EBP and often entails perceptions of that specific EBP. So how adaptable is it? Can it be modified and tailored to fit local context needs, right? Everyone here said many different settings that they're involved in. So we want to make sure that this EBP can be adapted to the specific setting you're working in, whether it's child welfare, school setting, an outpatient mental health clinic, right? There's also cost. So, the cost of operating costs of the intervention, of attending the trainings, complexity, how complicated it is, the number of steps it has, its scope, like who is able to deliver that specific intervention or EBP. We've talked a lot about the evidence base and the research support for it. The source, so kind of like who's the group that developed it, is or is like offering the training? Are they reputable, credible, trustable? The relative advantage of the EBP, is it better than other available interventions or the current practices that are being delivered? Design of it, is it well designed? Is it well packaged? Is it presented well? Like, is it clear? Essentially, you want to make sure that it's well designed. And then trialability too, like can an innovation be tested or piloted on a small scale first before having to go through these huge steps sometimes can be really helpful to see how that might work in your setting. Next, thinking a little bit about the individuals involved. So there's leaders, and leaders have there's varying levels of authority of leaders within an organization or setting, right? So there's like the high up level leaders, mid-level like managers, supervisors, and then there's also like individuals who are just like more like opinion leaders who are in our setting, who people really value their opinions and their thoughts on things as well. I'm thinking about roles of who's involved in the implementation process. Are there people helping to lead the implementation effort? Are there like external individuals who are helping with that? We'll talk a little bit more about like implementation team members, but is there a team helping to push this forward? Who's going to be involved in actually doing the EB, like implementing the EBP, using the EBP, and then who's going to receive it? So like, are there specific youth who are going to be receiving that EBP? Is this more universally everyone will be receiving it? And then thinking about characteristics of the individuals involved too. So like, what are the patient's needs, capability? So for those who are going to be using and delivering the EBP? Do they have the knowledge or the skills to deliver that? Opportunity? Do they have the availability to do it? the power to do it, and then motivation. Are they committed to implementing that EBP and fulfilling that role? At the organization level or kind of the inner setting, this is the setting where the intervention is being implemented, right? So it might be at school, it might be in a classroom, it might be a doctor's office or a clinic, or within a hospital. So there's structural characteristics, like infrastructure that needs to be in place. So physical stuff like certain space or materials that might need to be there, like having space for that treatment. There's one in particular, like parent-child interaction therapy or PCIT, that you may or may not be familiar with, but it involves a lot of like coaching of the parent interacting with their child. And ideally, they have like the room setup is that you have a room that the caregiver and their child are in, and then the clinician is in another room observing and providing feedback to the parent like in the moment. And so that requires a lot of like infrastructure and setup that will need to be in place in order to be able to implement that EBP. And there's also like IT considerations as well, thinking through like how you're communicating or just electronic documentation for a new EBP. And then just like work infrastructure, like organization of tasks and responsibilities. What does staffing look like? Relational connections, so high quality, formal, informal, like networks, teams. What is those basically teamwork? What does that look like? As well as like communication, right? So what does communication sharing typically look like? How will that work around this specific evidence-based practice? And then culture. So these are shared values, beliefs, norms of the setting. Um, so thinking about what the culture in your setting is and how that may or may not help facilitate the EBP delivery. Some more like inner setting or organizational level um, barriers or facilitators that can come up or factors are like tensions for change. So how much is the current situation needing to change, right? Is there that tension there? Compatibility, how much does the EBP fit with your workflow, with your system, with your processes? What's the priority level of it compared to other initiatives that might be going on or other types of trainings? Is there a specific incentive system in that's available? Like, are there certain rewards or incentives for implementing EBP, or are there like certain disincentives? Um, as well as how does it align with mission? And I know we talked a little bit about like available resources and how that aligns as well with EBP, as well as like access to knowledge and information to implement the EBP. So do you have somebody within your organization who's already trained in that EBP, who might be able to help facilitate that? Or is there nobody who has any experience with that? And so, that might not be an available resource at this time. And then thinking about the outer setting or the system level. This is a setting in which like the organization or that inner setting exists, right? So if you're a specific like hospital or clinic, maybe you're within a healthcare system. If you're a specific classroom or school, it's within a school district, which is within a state, right? And so we're all embedded in all of these different levels, right? And so at the system level, there might be like critical incidents that happen, like we've all gone through with the COVID-19 pandemic, which can really impact EBP delivery in our services, certain political events that might impact our ability to deliver a specific EBP, as well as like local attitudes towards specific interventions, so sociocultural values and beliefs that may help support or maybe not may not be as supportive of implementation of specific EBPs. There's also local conditions, like I said, political support and funding, the economic kind of environment, as well as what partnerships or connections are available for your setting, like with other external entities. Specific policies and laws can also impact the delivery of an EVP if there's certain legislation or regulations, sometimes even just like professional group guidelines or recommendations. So sometimes some certain states might have certain requirements or certain legislation around needing to use certain EVPs, depending on the setting. And then too, thinking about like financing, grants, like what reimbursement rates are available, especially through public funded like payers and insurance. And then external pressures too around societal pressure, market pressure, like needing to compete, and just like performance measurement types of pressure. So tons of information there, tons of factors, and it's a very overwhelming amount. And the reason that I wanted to just go through and highlight all of those is because I think us as individuals, we're like, yeah, this is great. I want to do this. And it's important to keep in mind all the things that are going to affect our ability to be able to deliver an EBP. And then within that as well, depending on your role, if you're someone who is more of a leadership role or has more of the being able to be a driver of change in your setting, then these are really, really important to think about and how can you best support your like supervisees and your employees and staff around being able to implement an EBP. And even if you are just kind of feeling like more like an individual within the setting you work in, these are really important because perhaps you can be part of an implementation team that's trying to support a change and being more aware of all these different factors and being able to think about these from the get-go can really help with long-term with implementation being more successful, as well as the potential for being able to actually sustain the EBP in your setting. So it's like a quick kind of point of just summarizing what we've talked about so far. Training is likely insufficient on its own. There's other barriers and challenges that play a role in the successful implementation of EBPs. And then the exploration, preparation, sustainment phases are also essential to successful and sustained implementation. So Baumgartner and Owen in one of their articles talked about that evidence-based programs or interventions should really be thought of as hardy seeds and not magic beans. So even the most effective interventions will be ineffective if the infrastructure, resources, and support are not there. And so having multi-level, multi-phase strategies are needed to address those barriers and help facilitate the implementation of EBPs. So now that I've gone through all of that, how can you support implementation in real world use settings? So there are over 70 plus different discrete implementation strategies, or like basically strategies are what we do to implement the EBP. And there's also a number of different resources, implementation planning resources here as well that can just help to guide the implementation process. The National Implementation Research Network and like University of North Carolina have an active implementation hub where they have a ton of resources available, as well as the EPIS framework that I talked about has a website where you can look at that in more detail, as well as the framework we had just seen, which was the Consolidated Framework for Implementation Research, or CFIR. So that figure that you saw with all the different levels, they have a whole website dedicated to more information about each of those factors. And then the California Evidence-Based Clearinghouse for Child Welfare also has implementation resources as well. So how to support EBP implementation and that exploration phase, so that first phase of implementation. So this is the phase where an agency evaluates needs, identifies the potential EBPs, and then decides whether to adopt a specific EBP. So some strategies for that are evaluating needs and potential areas in your setting that need to be addressed. And so there's some different resources I have listed here that can help with that. So basically identifying like where's your area of needs, what might an intervention help address, and then assessing the fit and feasibility of potential EVPs that might help address that need. So the the example hexagon planning tool, which I have an image of that on the right, has some different areas to think about for an EVP when thinking about would this be a good fit for our setting and for where we work, around like the evidence, how it fits with your setting, the youth you work with or your community, the usability of that intervention, like going back to is it well defined? Does the design make sense? Can it also be adapted to fit the context and populations you work with? Capacity. So what's like your setting's current capacity to be able to deliver that EVP? What supports might you have around like expert assistance, or what are some external resources? And then the need, how does it fit with the identified need that you had? Another important potential strategy that can be used during the exploration phase is forming an implementation team. So this consists of leadership, champions, opinion leaders, and a mix of staff, and sometimes can even include advocates or youth or family members as well. So we want leadership involved because we want people who can enact and drive change involved in those meetings and teams. We also want champions. So those are people who are passionate about and dedicate themselves to implementing the EVP. Opinion leaders, I know we talked a little bit about those earlier, but those are individuals in the organization who have influence and can create change. And we want to include all those individuals within the organization who will be crucial to successful implementation. So for example, in a project that I did with Dr. Kara Lewis, we were implementing cognitive behavioral therapy, or CBT, in residential treatment facilities. And it wasn't just leadership and therapists that were included in those implementation teams, but also supervisors and the youth care workers. And the youth care workers were the individuals who had the most time with the youth and were kind of the more like frontline direct staff. And so it was really important that they were included as well, since they were the ones who could really help support the youth using those CBT skills that they were learning. And so having them involved was also really important. So implementation team responsibilities can really vary, but they're really important throughout all phases of the implementation process. So they can help with making the decision around which EVP should be adopted, help lead communication, increase buy-in for that EVP, and then can help problem solve and think through what are some potential challenges that might come up for implementation sustainability, and then what are some ways we might be able to address some of those challenges that do come up. So moving into the next phase, which is the preparation phase. So this is addressing barriers and facilitators to implementation and beginning to develop those like implementation supports. So we've talked a lot about identifying like potential barriers and facilitators of implementation. You can use some of those frameworks I talked about are great guides for kind of thinking through what are some of the things that might come up at your setting. Sometimes people might do more of like a needs assessment to identify what those might be. So maybe having like staff fill out a survey or doing some interviews. Assessing the adaptation that might be needed for that specific EVP in your setting. So thinking through how it's going to work in your setting and for those who are delivering it, while still ensuring that you have those core components of the EVP so that we reduce risk of lowering the effectiveness of that intervention. So, if we're taking out important pieces of that evidence-based practice, it's no longer going to be as effective. So we want to make sure we're including those core components, but being able to adapt to best fit the needs of of the setting we work in. And then making sure we're incorporating, before we get started with the actual delivery of the EVP, the needed infrastructure for that specific EVP. specific space that we might need, resources, staffing, what's the billing situation going to be looking like if that's something that needs to happen, as well as like referral stream and thinking through like ensuring we have adequate referrals for the EBP, especially making sure that those youth are available soon after training while that ongoing support is available so we could start using that EBP and seeing how that's going. Some more potential strategies are making sure you're planning for training and implementation supports. So going back to the question that we had to around knowing that training itself is likely insufficient, it's that ongoing implementation support that really helps with skill development and changing behaviors. So how do we make sure that we have time for that ongoing support? Making sure there's that time for that consultation piece that people can get that feedback or that coaching that needs to happen, and thinking through from the get-go, okay, this is the training that's required for this EBP. How is that going to fit in with our workflow and our the way our organization is set up so we can ensure that those who need to attend that can do that? And is there ways we can work with those who are providing the training to maybe fit with the way we're set up a little bit more? Increasing buy-in. We want to make sure we're creating plan for collecting and reporting fidelity and other outcome data. So fidelity is that the intervention is being delivered as it was intended to be. It can tell us where there might be training needs or gaps, like if there's certain components that are missing from the EBP that aren't being delivered. And it also helps tell us if the outcomes are related to that EBP. And that's why we're seeing more positive outcomes, or if we aren't seeing any changes or positive outcomes, it can tell us, is this related to the EBP not being a good fit, or is it because the EBP isn't actually being implemented the way it was intended to be? So need to kind of identify if there's a certain tools available that can help measure that and have a infrastructure for that. And then moving into implementation. So this is initiation and integration of the EBP into practice. So conducting that training and having that ongoing support, maintaining agency support throughout. So leadership support of the use of the EBP, as well as rewarding EBP use can really help facilitate the implementation of EBPs. And then kind of actually collecting that data and monitoring it around fidelity and outcomes, like youth outcomes, and providing that feedback back to see where there are areas where that things might need to be addressed. So is there like poor attendance at consultation or coaching calls? Is there a lack of referrals? Maybe time is an issue here again with like planning time or kind of tension between productivity requirements and being able to use the specific EBP. And then there are specific methods for like addressing barriers that might emerge that you can test out or use. One is the Plan, Do, Study, Act method. That's just a method for planning and testing a change to address a problem or barrier. There's many different ways you could try to address barriers. This is just an example of one that might, like a formal way of doing that might be helpful. And lastly, thinking about sustainability and potential strategies for that. So we want continued integration and implementation of the EBP, and we want to ensure sustainability of that over time, including funding, thinking through, especially from the get-go, if there's like a grant that's helping to initiate that EBP program, how are we going to maintain this over time and continue to sustain it will be something that's really important to think through long term. What's the plan if we notice that fidelity isn't being maintained or drops down, having a plan in place for that, of how to address that. And then also planning for workforce turnover, which we know is just a really big challenge to EBP implementation and sustainment, and can create a lot of challenges. And that's something really important to think about and keep in mind over time. What are we going to do to make sure that as people leave or there's turnover, that we can continue to provide this evidence-based practice? So pretty low on time. I want to make sure that if there's questions, we have like time for a question. But overall, we know there's a really critical need to make sure that youth have access to high quality, effective behavioral health services. We know that these remain underutilized in community settings, and so multi-level and multi-phase strategies are needed to help address barriers and facilitate the implementation of EBP so we can increase the availability, accessibility, and impact of these evidence-based practices. And then here's my email address too. If you have questions, like additional questions after, feel free to reach out to me.
Yep, and the PowerPoint will be sent out this afternoon, so her Dr. Marriott contact information will be in there as well. We don't have time for too many questions, but I think the first question is going back to that phased approach of implementation. I think it was between the second to last step and the last step, which is sustainability. Is there any research around time frame of that? Like if you're in that third phase right before sustainability too long, does the chance that it actually sustains go down? Just do you have any information or research on that specifically?
Yeah, that's a really good question. I think that that's something that's actively being studied more now with like during these implementation projects, people are monitoring like what steps or stages they're in and how long that takes place. And I think what the initial findings so far are that those pre-implementation, the exploration and preparation phases, spending adequate time in there and actually having activities done in those phases is related to better implementation and sustainment. As for those like other pieces around like how long in implementation or how long in those phases, I think that's still a question that we need to answer. But definitely those beginning phases, I think where people often rush through are really important and spending time in those can really help. And in general, I'd say implementation always takes a lot, the whole process takes a lot longer than we want it to. But given the investment that's often involved in it, we do want to make sure that we're, taking our time to make sure it's done well too. But it does generally take a long time in general.
Yeah, and you might not have information on this, but the other thing that made me think of was the kind of turnover and retention of people that work in this space specifically, and how that might affect the sustainability of an EBP.
Yeah, absolutely. I didn't get to talk too much about it at the end there, but turnover is something that's so important to think about at the beginning and especially like in behavioral health, it's like 30% turnover and so there's a lot of challenges to that and needing to retrain people and things like that. So something to always plan out from the beginning, knowing that that's something that will probably come up.
Yep. Yep. Thank you for that. And so with just a couple of minutes left, we are going to close out the webinar. Thank you, Dr. Marriott, for that incredibly helpful and interesting presentation. As we finish up the last few minutes here, I'm going to bring a few events that we have coming up to your attention. The first is our 2025 Kids Count Conference, a 2-day experience dedicated to your work and supporting the well-being of children in Indiana. We have engaging sessions, networking opportunities, and insightful keynotes, including Max Greenfield, who you may know as Schmidt from New Girl, which is really cool. Additionally, we have some upcoming webinars on November 18th. We have Preparing Indiana's Youth for High Demand Careers. And then January 21st, we have the 5 Practices of the Caring Mentor, which is for National Mentoring Month. Finally, as we close out here, to receive the latest updates and opportunities outside of what I just showed you, IYI.org/newsletters. And with that, we appreciate your impact, voice, and choice to learn and partner with IYI today. This afternoon, you will receive an email that includes a copy of the presentation and a link to complete the evaluation of the webinar. I know there's a question about the evaluation in the chat. So in the email that you received this afternoon, it will include a link to the survey evaluation. Once you fill out that survey and click submit, it will direct you to your certificate of attendance, which is how you get that. If you don't receive the evaluation email, check your junk as it may have been directed there. And so with that, we will conclude our presentation. And once again, thank you so much for showing up today and every day for Youth in Indiana.